Hello everybody, welcome to day 22. I'm going to be talking about some genetic factors and individualized components for weight loss. But this is also going to encompass some health issues. You'll see why in a minute. So I purposely did not talk about saturated fats yet. I'm going to talk about them now because saturated fats is in fact one of the things that maps onto genetic components of weight loss. Now, before I delve into this, let me just couch this discussion in a bigger topic. I've made the claim that 75% of adults walking around right now are type 2 diabetic. I'm not the only person to say that. There's many professionals that believe those numbers. It doesn't matter if you think it's 50% or 80% or 60%. The point is it's big. But here's what we do know. We do know that 70% of Americans are overweight or obese. There are studies that show that only 12% of Americans are metabolically healthy. Now, I say that because of this. In order for me to have this discussion with everybody regarding saturated fat, I'm talking to the people that are metabolically unhealthy right now. That's 88% of you. And then I'll have a different discussion with the 12% that aren't. And here's what I want you to use as your marker. The marker I want you to use is insulin resistance. Meaning, if you see that cluster of high blood sugar, you could just start off with high blood sugar. If your blood sugar is high and it is persistently high, that's type 2 diabetes. Meaning if you're over 115, some people will say 125. I'm telling you, if you're over 115 consistently, you're type 2 diabetic. If you're between 100 and 115, you're pre-diabetic. Ideally, your blood sugar is somewhere around the mid to high 80s, even the low 80s, somewhere around there. So when it comes to saturated fat and weight loss, I will tell you this, guys. You can look in some of the best top journals in the American Heart Association right now. They are taking away their statements on saturated fat over the past couple of years. They're done vilifying it, finally, and for good reason. However, I will tell you this. There are people who should be concerned about the rise in LDL that saturated fat causes. And it does cause a rise in LDL. And you may say, well, wow, yeah, isn't LDL what causes heart disease? Well, it contributes to heart disease in people that are already metabolically unhealthy, meaning if your triglycerides are already high, your blood sugar is already high, your blood pressure is already high, and you go and have a high saturated fat diet in the context of the stuff you're currently eating, meaning you're not doing any of the things that I've been talking about for 21 days, the high fiber, the high protein, lowering your sugar, purposeful exercise, NEAT, hydration, proper sleep, all those things that we've been delving into, getting rid of the polyunsaturated fats, especially vegetable and seed oils. You get the point. In that context, high saturated fat diets will absolutely contribute to heart disease. However, if you're metabolically healthy, saturated fat is probably the most important thing you can be consuming in order to be lean and stay healthy. The rise in LDL that comes along with it is being argued now more than ever actually healthy as opposed to unhealthy, because you're getting the larger LDL particles. And I don't know if I've done videos before on LDL and how LDL is just thought of as like LDL, but LDL comes in all different particle sizes. And what we see in a metabolically healthy person, that those LDL particles tend to be the larger, lighter, buoyant ones, which help in what? What did I already tell you guys? In hormones. So you need LDL for hormones, and hormones are everything, guys. I can make an argument that you should be more concerned about extremely low LDL particles as opposed to higher LDL particles. You should be really concerned if your LDL particles are very, very high in the context of high triglycerides, high blood pressure, and all that stuff. Now, it turns out that there are genetic polymorphisms that we could look at in your 23andMe test. There are a cluster of them that map onto how well you metabolize saturated fat. And I'm just teasing this discussion today. I'll go into it more over the next couple days. So it can actually affect how well you lose weight. But I'm telling you that how well you lose weight, meaning if you're already metabolically unhealthy, which I'm going to assume most of you are because you're doing a fat loss challenge, right? The topic here is weight loss. So the topic is going to be in those people that have issues with metabolizing saturated fats, and I'll explain how and why that's happening in future days. Should you be following a lower fat, slightly higher carb diet? See, that's what I'm saying, right? When I talked about focus on protein, getting it high, focus on high fiber, getting it high, right? Moderate your fats and carbs. If you just do equal amounts of both because you don't know your genetics, you'll be okay. But if you happen to know your genetics, then we can discuss, maybe slightly lower fat for you and higher carb, maybe slightly higher fat, lower carb, at least until we get you to the position where we look at your blood work and across the board it's healthy. Then I would make the strong argument to go ahead and start increasing your saturated fats and decreasing your carbs because, we'll talk about why in future videos, about what is it about saturated fat that's so important and satiating and what are its effects on the metabolism overall. So that's just a teaser, guys. I hope you get the idea. That's where we're going to be heading the next few days. But again, to couch this discussion and what I was talking about earlier, it is important to recognize that when we talk about things like this, we're talking about where are you on the spectrum of being metabolically healthy. If we're not concentrating on losing weight the way I'm describing, you're going to remain metabolically unhealthy, and therefore, yes, you should keep saturated fat lower in your diet. But obviously, if you don't get rid of the sugar and all the refined carbs, you're just going to get destroyed eventually. Do what I'm telling you to do, and I promise you that as you become more metabolically healthy, you'll be shocked at how things start to reverse to you. So there's like a switch, there's a point at which your body just starts to boom. It starts to just fire up and it starts to kind of get it. And then you can start doing the right things for yourself because you become metabolically healthy. It's very hard to get the car running when it's been sitting in winter for months and months and months. But once it's going, man, it goes. And that's the same thing with your body. Please follow what I'm telling you to do. Please keep making the effort day in and day out. And you'll notice that once the car's running, there's all these cool things we can start to do, and you'll never have to look back. All right, guys, have a great rest of the day.